Hello and welcome to the award-winning Waterman Wellness, your pathway to health and wellness with local experts as your guides. I'm Melissa Hritzik. There's a lot in store in this month's episode. Pain in your legs could be due to a deeper issue. Stay tuned to learn how this vascular surgeon can treat certain patients. A local expert explains a highly contagious virus common in very young children. Plus, you'll learn a hearty pasta recipe that is elegant and also good for your digestive health. Our first story looks at treatment for a form of cancer that has a very positive survival rate.
Colorectal cancer is one of the most common cancers in the United States in men and women. And we're doing a better job in treating and actually curing colon cancer. So screening is very important for colorectal cancer, and screening is by doing a colonoscopy. There are certain guidelines for screening. It depends on the patient's age and family history of colon cancer, since colon cancer can also be familial in certain occasions. The treatment of colon cancer is, in earlier stages, is surgery. So we try to cure it by taking it out.
Surgical oncologist Boris Mascarenhas says patients are first screened to see if the cancer has spread to the liver or other organs.
Now, in terms of colon cancer, if preoperative staging, which involves getting a staging scan of the abdomen, now if it shows that the colon cancer has already spread to these organs, then we do not go after the colon cancer surgically straight off the bat.
We can still do surgery in some patients with stage 4. So let's say a patient has colon cancer with 1 or 2 lesions in the liver. We can give him chemotherapy, and if it is successful and shrinks the tumor, we can still go for surgery and aim for cure.
One of the main advantages in colorectal cancer has been the use of laparoscopy. Laparoscopic colectomy has markedly decreased the length of hospital stay. We are actually seeing patients have bowel movements 1 to 2 days after surgery, which normally would take 4 to 5 days. The amount of pain and other comorbid problems has markedly decreased.
So we are able in some patients, in certain cases, to cure even stage 4 colon cancer by what we call multidisciplinary approach. So we have the medical oncologist, the surgical oncologist, and sometimes the radiation oncologists are all involved, work as a team to come up with a plan so we can help the patient get the best results and maybe cure even at stage 4.
Visit fhwatermancancer.com to find a local expert and to learn about advanced treatment for cancer available right here in Lake County. Next, we turn to vascular disease, a potentially dangerous condition that often doesn't have symptoms. But once diagnosed, specialists say minimally invasive treatments are available right here in Lake County.
Peripheral vascular typically deals with poor circulation in the legs, kidneys, carotid artery disease, which can cause stroke, and aneurysms, abdominal aortic aneurysms. If it's peripheral vascular disease in the legs, then they typically get pain, either pain with walking, or advances to pain all the time, or advances to where they have a non-healing wound, or even gangrene. Carotid disease can manifest as a stroke, or a mini stroke, TIAs, transient ischemic attacks.
Dr. Hannum says some patients can improve with medication.
Peripheral vascular disease, if it's milder, can be treated medically, with medicine. If it's moderately advanced, then which is probably most people, then that we can usually fix with angiography, angioplasty, stents. There's what's called atherectomy, which is removing the plaque, and so you can fix things through a relatively small puncture site. Most people are familiar with a heart catheterization, so it's very similar to that. We do the same thing in the legs, kidneys, or even in the carotid arteries, and so you're just going with basically a relatively small needle and tube, and you can look very specifically at the arteries, the arteries to the legs, kidneys, or the carotid arteries, or the arms. And then, if you see a blockage, you can actually fix it with a balloon, stretches the blockage, stretches the artery. A stent does that, but the stent is metal and stays behind.
Dr. Hannum says many patients are able to go home from the hospital after a day or 2. You can find a vascular disease specialist by visiting fhwaterman.com. Heart health was the focus of many community events in February. The Women's Hot Topic Breakfast at the Tavares Pavilion on the Lake was hosted by Florida Hospital Waterman. The event featured a diverse panel of medical experts who focused on total wellness for women.
Brings the community together and gives us an opportunity to tell people about some things in medicine that they may have had questions about but not know where to get answers.
You can get answers to your questions about cardiac health by visiting the website on your screen. Our next story is about a serious condition that often affects young children this time of year.
Respiratory syncytial virus, which is a good name for it because it's a very sticky, wet virus that causes wheezing, often in children under age 3 because of the smaller airways of their, and it presents much like asthma, though may not always be responsive to asthmatic medicines. Its differences between other respiratory viruses, it just seems to be more severe just because of the nature of the virus. Also, the nature of the mucus it produces tends to be thicker and more pronounced than other respiratory viruses.
Dr. Baker says treatment for the virus focuses on relieving symptoms.
Albuterol is given in a nebulized form with the hope that it will loosen up the mucus and or dilate the airways so they can cough up the mucus more efficiently. And by the same token, saline or hypertonic saline will hopefully break up the mucus much better and allow the airway to function better.
Dr. Baker warns that RSV is highly contagious and symptoms can last for 2 weeks.
Most people are contagious sometimes before they even develop any symptoms. The virus can shed for up to 2 weeks in a lot of cases, so even the patient recovering can still transmit it as well.
You can find a specialist to help you with your child's health by visiting the website on your screen. We're going to take a short break, but stay tuned. There's plenty ahead on Waterman Wellness. This woman is alive because of the quick action of a local emergency department. Don't miss her powerful story. A local specialist shares advice that she gives to expecting parents in Lake County. And we'll visit the Con Recreation Health Center kitchen for an easy-to-prepare pasta dish that is actually good for your gut. You'll find additional health and wellness information in Waterman Wellness magazine. Visit watermanwellness.com to arrange for home delivery, and you'll also find a listing of the specialists featured in this month's episode. First, we thought you'd like to know about these upcoming events. We'll be right back. Welcome back to the award-winning Waterman Wellness, your pathway to healthy living with help from local experts. I'm Alyssa Hritzik. Next, Waterman Wellness wants to share the compelling story of a local heart patient who is alive today because of the Florida Hospital Waterman Emergency Department. She shared her story at the recent Foundation Gala, which raised money to expand emergency services.
I was in room 16, I'll never forget that.
I had felt totally fine. I just figured it was going to be like any other day. I was going to walk into the emergency room and see why I was short of breath, and no idea it was going to turn into what it did.
She was talking, she walked in on her own power. She didn't appear ill at the time, but I remember that she had told me one specific thing.
I was born with a congenital heart defect. I had my first surgery at 9 days old, and then I had another surgery at 14.
She had something that she was born with called a coarctation of the aorta. And so I thought, you know, she's coughing, she looked like she's breathing a little bit faster than I would think, and so we're gonna go ahead and get a CAT scan. The next thing I know, I was in a different room, and I hear Brant, the nurse, screaming to get in the room. And I run into the room, and I see her with a pink bucket and basically a tube of blood coming from her mouth into the bucket and the color just draining out of her face.
I had a really, really bad pain, kind of a tearing pain in my chest, and I just knew it was going to be really bad.
She probably lost much more than half her blood volume in her body within minutes. I knew that something between her aorta had broke because there's nothing else that could produce that much blood flow in that short period of time. And when your aorta breaks, the chance of you surviving approaches zero. And I immediately told the clerk to call Gary Allen, who is our cardiothoracic surgeon. And I walked back in the room and realized we still had no IV access. We rushed to place what's called an intraosseous device, or an IV basically into the bone, in order to start giving medications, blood products, whatever else we needed.
One of my wishes was to have my boyfriend called.
She kept saying, "Can you call my fiance? Can you call my fiance? He's a nurse on the ICU." I remember her saying that over and over. And the nurses kept saying, "No, no, no." And then I said, "No. You need to call him," because I thought this is the last wish.
I was sound asleep because I work nights, so it took multiple phone calls. Dr. Allen's PA calls me and tells me to just park the car in the ambulance bay and leave the keys in it. So I'm like, well, she's dead. There's no possibility that they're going to have me park in the ambulance bay if she's still alive. It's just, she's dead.
She was staring death in the face, and the reality was she stayed incredibly calm. And I immediately told the nurses no IV fluids. I want her blood pressure as low as possible, because the only hope for her to survive from here to the operating room is if her blood pressure stays so low that the pressure on whatever broke open closes itself. And within about 2 to 3 minutes after we got IV established, we got emergency blood products, she stopped bleeding. Now again, the line that I put in, you could not do the specific CAT scan you did, like anywhere. It's not made for that. And I remember arguing with the CAT scan tech, and they're like, "We can't do it."
It was so much going on. I just know when I was in CT, I could hear Dr. Patina yelling because I couldn't get an IV in me.
I remember looking at one of our nurses, Christine, and I said, "You have 30 seconds to put an IV in her." And lo and behold, Christine gets an IV in a person who has almost no blood, who they couldn't get an IV in to begin with, and she gets it within 30 seconds. And so we do the CAT scan, and I see this massive aneurysm that had essentially ruptured into one of her breathing tubes on the left side. And the amazing part, even to this day, not that she stopped bleeding, but that she did not drown. Most people would drown with 1/10 of that volume. And we get her back to the ER. As we're working a stabilizer, the cardiothoracic surgery and the team comes in. He realizes that this is a very big deal.
She was dead. There was no possibility she should have survived. Everything just fell exactly into the right spot at the right time. The hospital had what they needed, got everything done the way they were supposed to. The best care that she could possibly ever ask for.
I was the person that everybody had to do the right thing for them to save me, and they all did. Right place, right time, right people. If one thing had gone wrong, I wouldn't be here.
More than $111,000 was raised at last month's gala. For more information about emergency services and to find out how to support the Foundation's fundraising campaign, visit fhwaterman.com. It's time to switch gears to focus on healthy meals. We head to the Conry Creation Health Center kitchen, where the Florida Hospital Waterman team is cooking up something that is good for your digestive health. Today we are here with Florida Hospital Waterman Executive Chef David Atkinson and registered dietitian Peter Weiss. They're going to share with us a delicious recipe that's also good for your digestive health. Peter, can you tell us a little bit about this recipe today?
Yes, today we are cooking a broccolini with a ditalini pasta, as well as white beans and pecorino. Now the key ingredient being the broccolini is going to be beneficial as far as the fiber content for digestive health.
Wonderful. Dave, can you show us how to get started?
Sure. This is a quick and easy pasta. We have our fresh broccolini, cannellini beans, ditalini pasta, garlic, water, the pecorino cheese, and olive oil. We'll start by sauteing our broccolini. And you could use broccoli, you could use broccoli rabe, any dark green leafy vegetable, Swiss chard, spinach.
With using broccoli or any other vegetable like that, the important thing is going to be the fiber content, as that's going to help keep regular and prevent a sluggish digestive system.
We're going to add our fresh garlic next. Now I'm going to add just a little bit of water, and we're going to kind of steam saute this. We're going to cook it for probably about 5 minutes, just so it starts to soften but is still al dente. Then we're going to add our white beans. We're going to add our lemon juice, a little bit of salt, cayenne pepper, our pasta.
Now, is the pasta pre-cooked?
Yes, we pre-cooked the pasta. And we're just going to want to heat this through a little bit. So now that it's heated through, we're just going to add a touch more olive oil.
It smells delicious.
And then we'll go ahead and plate it up. And we'll finish it off with just a little bit more of the pecorino cheese. And there we have it.
Looks delicious.
Thank you, Chef. If you'd like to try this recipe, you can visit watermanwellness.com. Next, a Lake County obstetrician wants expecting parents to know about a free program that helps with the transition of having a baby.
A lot of times at the first obstetric visit, I also refer new patients to childbirth classes where they can get more information about what to expect during the pregnancy, information about breastfeeding, things like child safety such as car seats, as well. The nurse who teaches that class is a labor and delivery nurse. It comes like in intervals of a few months. So generally I recommend most women start that somewhere in the early 3rd trimester or late 2nd trimester. So they get a lot of insight about what to expect during the labor and delivery process when they go to the Center for Women and Children.
The Florida Hospital Waterman 5-week prenatal class is offered throughout the year on Thursday evenings. The next series begins April 13th. To register, visit fhwaterman.com or call the number on your screen. We hope you've enjoyed this month's episode of Waterman Wellness, your pathway to healthy living with help from local experts. Be sure to watch for the April episode right here on Lake Sumter TV for some of the following stories. What are the early signs of stroke? We'll hear from a local expert who explains symptoms you should be aware of. Flip-flops may seem part of the official Florida uniform. Watch next month to hear why you should think twice about wearing them. And Chef Dave will show us the perfect picnic recipe. Your family won't even know it's good for them. To learn more about the experts featured in this program, please visit watermanwellness.com. Until next time, I'm Alyssa Hritzik for the award-winning Waterman Wellness.